So my name is Zack, and I am the recovery coach for the Center for Hope in Blackwood, Idaho. The way I would define myself is, um, I don't know, I'm caring. I am genuine. I try to be brutally honest. Um, Pretty transparent, and being a recovery coach is, like we've been there. So so my first encounter with opioids or prescriptions was it was a prescription. It was from a doctor. Um, when I was young, I was in an accident and got burned and was given a lot of prescription medication because I had to do burn therapy. And then I just spiraled out of control. And then my drug of choice was heroin and any opiate prescription I could get my hands on. Yeah, yeah, I got burned. So my family owned Taco Bandito. There was a restaurant on First Street, and I got burned while she was changing the grease traps. So it was like 55 gallons of hot grease that got spilled on the floor, and I slipped in it, and it sucked. Like yeah, it was not a good experience. So I had to do burn therapy, and that was uh that was something else. It's when it's good, it's really good, and when it's bad, it's really bad. Um, there's not a lot that you there's basically nothing that you won't do to get what you need to get well or to get your fix. My recovery journey was rough. There was a lot of relapses. There was a lot of second guessing myself on if this is what I wanted to do or how I wanted to do it. Um, I really had to allow myself to realize that I didn't know how to be sober. I didn't never gave myself the opportunity to be sober through school or anything. Like I was always on something, and I had to relearn what I like to watch on TV, what I like to eat. Um, and it's scary because for so long you are a certain type of way, and then everybody just expects you to change. Everybody expects you to just not do what you've been doing your whole life. Um, and it's a lot. It's the hardest, easiest thing anybody can do. Um, not doing drugs is the easy part, and dealing with the emotions and feelings that those drugs were blocking out. That's the hard part. So it probably took me a full year to figure it out. I put together a couple months and then relapse, and then like I tried to, oh, I'm gonna drink and smoke weed and be sober, and it just always led me right back out to um, using. And then my cousin died of an overdose, and then I overdosed on fentanyl, and that was a real eye opener for me that maybe this isn't what I want with my life. And then once I really dedicated to the change, there was no looking back. I put so much drive and effort into being an addict, and that's who I was, and that's what I was, that there wasn't anything that would get in my way of me getting high. And, you know, I decided that if I could put all that effort into living that double life and doing that and going through all those things to do that, that if I were to put half that drive into staying sober, that there was nothing that was going to stop me. I won't ever say that I will never relapse again. I'll never say that. Oh, I'm completely done. Do you know what I mean? Like I'm one bad day away from a relapse. It's that other person's inside me. Once an addict's in you, that addict will never go away. And through utilizing uh, groups or self-help groups or mentors, you know, my recovery community, that's what helps me not go back out. Um, I ignorance. I uh I I got sick of proving everybody right. Um, I had told that same story for so long of, oh, this will be the last time. I'll never do it again. And just always went back to it. So in the back of everybody's head that was in my life was, it's not if, it's when he goes back out. And, I proved him right there for a little bit. And then finally, I just got sick of being a hypocrite. I got sick of looking at myself in the mirror, knowing that I was going to have to lie to everyone I loved to continue through my day. I think the biggest thing that helps me embrace my recovery is the people around me. If you're around positive, uplifting people, you're gonna strive to be on that level. If you're around people that aren't gonna hold you accountable or aren't gonna call you on your bullshit, you're not gonna do good. That's a good question. What would I tell someone in the midst of active addiction? Oh, you've got to get to your complete rock bottom before you'll find help. And that looks different for everybody else. And being being an active addiction, it can always get worse. And it can get better. It's a lot. I mean, I'm 3 years hard sober and I still have thoughts of using. You know what I mean? Like I always get that thought that, oh, hey, I deserve this. I find myself at least twice a week standing in front of the beer section at the gas station, and but I know it's that addict inside of me trying to get a hold of the wheel, you know. Let me put it to you like this: so you're driving down the highway and you've got a passenger in your car that is going to reach over and yank the wheel as hard as they can at any point in time. And if you're not ready for it by reaching out or having direct communication with people or transparency about how you're feeling and what you're feeling through, like it's only a matter of time before that person reaches over and yanks that wheel and you can't control it. So, I mean, support is a huge part of being sober. Um, I white knuckled it a lot in the beginning. I had that terminal individuality of, oh, nobody knows what I'm going through. Nobody's been through what I've been through. Nobody feels what I feel. Well, of course, nobody's going to know exactly what you're going through. But through utilizing the rooms of recovery, I sat there and really listened about what other people were going through. And they may not have been through the exact same things that I've been through, but they've been in enough similar situations that what they were sharing through their experience, strength, and hope, it helped me get through what I needed to get through. Someone that has never used opioids to know um, that that drug addict that they want nothing to do with, that's somebody's kid, somebody's dad. Oh, tried to tell myself I wasn't gonna cry. It's yeah, it's a person. It's somebody. It's somebody loves them, and yeah. I think that's, just realizing that we're all people. For me, it's, the like be loud about recovery, be educated about your recovery, be be helpful, a lot of people think that, an addict is always going to be about themselves and not want to help, or they're just a drug addict. You put that box on someone, and you know you've got to look at the situation of where the trauma come from. We've all been through trauma. We've all been through something that could have turned you into a drug addict. But you had some of the key things that a lot of addicts didn't have. Probably loving parents, a safe household to go to, and it takes a lot for people to step back and look at it through the lens of, what can we do as a collective to help make sure that our kids don't go through this. You know, it's scary to think what the streets will be like in 20 years. So there's 988. There's the Center for Hope. There's a Center for Hope in American Falls. There's a Center for Hope in Soda Springs. There's a Center for Hope in Blackfoot. There's a Center for Hope in Idaho Falls. And there's a Center for Hope that just opened in Rexburg. So those are really good resources. And there's Brick House Recovery. There's Stewards Recovery. I mean, there's a lot of places around here. RHS is a huge one for mental health. I utilized RHS for counseling to help get me where I'm at with trauma therapy, and that was monumental. So we are able to distribute Narcan 100% for free through digital reporting, and there's no questions asked. If someone comes in and needs some Narcan, cool. Oh, you need 2. Here's 4. And the thing about it is it's a needed thing. It's needed. People need it. People that don't do drugs need to carry it with them, unfortunately, because you just don't know right now with who's getting what, or, oh, hey, I've got an aspirin for you and it's got fentanyl in it, or there's, like it's in everything. And unfortunately, you never know. It's not that bad on this side of the fence, you know. It's a lot better. It's not always better, but it is. There's a lot that, through active addiction that I personally never paid attention to, that was some of the most beautiful things that I've ever seen. I mean, look outside. Like we're blessed. Like we have the opportunity to see mountains. We get snow. We get stars. When I was in bigger cities and it's dark and it's the only light that you get is man-made light. We have some of the best hiking, fishing. I did a lot of that stuff in addiction, but I don't remember doing any of it. And I mean, if you're thinking about getting help, make that call. So 988 is like, it's a crisis hotline, and you can call and they can help direct you towards, it's for like suicide prevention, helping find the recovery centers, or, just help. It's a help hotline for prevention, whether it be use or suicide. And then Brick House Recovery it's a treatment center. Same with, and they are a religious-based treatment center. They're an LDS-based religious treatment center. I've personally seen people go in there that didn't want anything to do with recovery, and now they're 2 years sober, and it has a lot of good morals and values. It's got a lot of good impact. It has a good impact. And then there's Stewards of Recovery. That's another treatment center, and they do IOP, which is outpatient. Same with Brick House. Um, and Stewards offers a intensive inpatient, a 90-day treatment. So they do have a detox facility that they are able to help people with. And then RHS has everything from like juvenile to adult caseworkers, stuff like that. They offer counseling to all needs. I used a lot of the MDR, which is a trauma therapy, which was very, very helpful, and it was good. It helped me get some of the stuff that I needed to get off my chest that, I didn't necessarily have a hand in, but what I went through. And that's a big thing.